everyone. My name is Janie, and I have Amanda here with me who will be presenting Pharmacy and Respiratory Health today. Mackenzie and Nick are our co-chairs for Respiratory Health in the College of Pharmacy. On the picture at the right shows the respiratory tract, and the lungs kind of branch out like branches on a tree, as you can see in the gray, and our lungs allow air to enter and leave the body. For instance, we inhale oxygen and we breathe out all the carbon dioxide. And our lungs have little air sacs that allow oxygen to pass through into our blood. And if you look closely, they kind of look like clusters of grapes. So we're going to start with a short breathing exercise. This is our rundown for the exercise. So first we're going to breathe in for 4 seconds, hold it in for 4 seconds, breathe out for another 4 seconds, and then hold for 4 seconds. So this will be repeated for 4 rounds. However, I'll do a simple 1 round of a run through. And if you're watching this at home, I highly suggest you to just pause and try this activity out, because it's actually pretty interesting to see how we do this. So I'm going to start. So you're going to breathe in, 2, 3, 4, hold, 2, 3, 4, breathe out, 2, 3, 4, hold, 2, 3, 4. And like I mentioned, you will repeat this for a total of 4 rounds. Different jobs that focus on respiratory health. This includes a respiratory therapist. They primarily focus on helping patients with COPD, asthma, or emphysema. And there's also personal trainers that help people become physically active, so it kind of decreases the chances of their asthma attacks. We probably don't really put much thought into this, but yoga trainers actually help us connect our breathing with their movements. And of course, there's pulmonologist, who is a doctor that focuses on the lungs. And of course, pharmacists, which what we're talking about. And in the next few slides, I'll be talking about what pharmacists do. So what is pharmacists' role in asthma and other lung diseases? So pharmacists help people develop their asthma action plan. We help and teach people how to use their inhalers. And we help people quit smoking if patients are interested in quit smoking. And pharmacists also offer vaccines and help inject those vaccines to prevent any respiratory diseases like pneumonia and the common flu. Pharmacists also help people recognize symptoms of asthma attacks. So when needed, they will get their rescue inhaler, and hopefully they can keep it under control.
So the second activity we have for you today is called a spirometry test. And what this test does is it tests how much air you are able to breathe out as fast as possible or as long as possible. So basically what you can do is, if you have a balloon or maybe a bag at home, you can take this out. And in order to measure your FEV1, you take the balloon and you blow out as much air as fast as possible in 1 second. And that is how much your FEV1 is how much air you can exhale in 1 second. And then to get your FVC, you blow out as much air as possible and however long it takes. So you breathe in, take in as much air as you can, and then blow out into the balloon as much air as you can and as long as it takes. And that's your FVC. As pharmacists and providers, we use these 2 numbers to diagnose various lung conditions such as asthma and COPD. And these numbers are really useful in figuring out whether or not you need to be on any sort of inhaler therapy. So asthma and COPD are becoming more prevalent in the United States. And asthma is one of those diseases that's more common in children. So it's seen in more than 6 million kids in the US, and the number keeps rising every single year. So asthma is inflammatory lung disease, and it causes our airways to become constricted, which makes it really hard to get oxygen into our lungs in order for us to breathe. So the way we kind of explain asthma to people is if you took a straw and you plugged your nose and then all you could breathe out of was your straw. That's kind of what happens to your lungs with asthma. So how do you get asthma? So a lot of different things can cause asthma. So on the figure on the right, you can see pet dander, stress, certain medications, dust, air pollutants, smoking, even genetics can play a big role in asthma. So we can exercise more in order to strengthen our lungs in order to prevent asthma attacks. And then we're moving on to inhalers. Janie will take over.
So as you can see on the picture on the right, there's many different inhaler types for asthma and COPD. And different inhalers require different techniques and instructions on how to use them. So like I mentioned earlier, one of pharmacists' roles is to be able to teach people how to properly use their inhalers. Today, we're going to focus on 3 main types of inhalers that will be described in the next few slides. This is what a meter dose inhaler looks like. This is probably the most common type of inhaler you would see. I also attached some image to help me describe the instructions. So first, you would want to remove the cap, as depicted on the right, and shake the inhaler first. And then you would want to breathe out all the way. Then you would bring the inhaler to you and make sure your lips are sealed on the opening of the inhaler. You want to breathe in and press down on the canister. And you would hold your breath for 10 seconds and then you would slowly breathe it out. Some people, especially children, do have trouble with the inhaler. So that's when a spacer is used. And on the bottom picture, you would see it it's this purple, I would call it a tunnel personally. And that's when you attach it to the inhaler and kind of similar instructions. You would still shake um, the inhaler and remove the cap. And after you insert the spacer, you would still breathe all the way out and press down on the inhaler, slowly breathe it in, hold it for 10 seconds, and then breathe it out. This is a dry powder inhaler. Um, this is really kind of less common, but you would open the inhaler by kind of flipping it to the side, and you would breathe out, and you'll make sure your lips are also sealed to the opening of the inhaler, and you will breathe in deeply, hold your breath for 10 seconds, slowly breathe it out, and you would close the inhaler as shown at the picture below. Lastly, this is our soft mist inhalers. Um, so as shown on the right, the instructions would be to first twist the inhaler, and typically at the bottom of the inhaler, it does tell you which way to twist it. Like as it's shown here, it would have arrows that will indicate where to twist, and then you open the cap, and you again, like all inhalers, you would make sure that your lips are sealed around the mouthpiece of the inhaler, and you would breathe in and press the button as shown on the right where the fingers are. You would press the button, hold it for 10 seconds, and then once you're finished, you would put the cap back on and it's ready to use for the next time.
So we talked about asthma and inhalers, and we're going to move on to tobacco products and cigarettes. So using tobaccos and cigarettes, nearly 14 out of 100 US adults age 18 or older currently smoke cigarettes. So how many people do you know that smoke or use tobacco products? I would say most of us know at least one person that either smokes or uses a tobacco product. And so it's pretty prevalent in the United States, and it can cause a lot of diseases. So we need to really crack down on the cigarette smoking, and then we can prevent all these preventable diseases. So on the right hand side, you can see all of the different cancers that could be caused by smoking. And On average, smokers die 10 years earlier than non-smokers. So you never want to pick up a cigarette, or if you know anybody that uses some cigarettes, maybe talk to them. There's that quit now phone number on the bottom of this figure. Give that phone number to them. And then also a big statistic here on this slide is 1 in 5 deaths are caused by cigarette smoking or secondhand smoke exposure in the US. That's a lot of people that are dying from a preventable disease. Some of the diseases include cancer, heart disease, stroke, other lung diseases, diabetes, COPD, all of those things. And smoking is a major risk factor for all of these diseases. So cigarette smoking affects your lungs, and we talked about our lungs a little earlier, but how cigarette smoke damages your lungs is those air sacs that look like grapes, what we talked about earlier, the alveoli. They damage those, and then oxygen can't pass through your lungs, and then you can't breathe. So if you even have asthma, tobacco smoke can trigger an asthma attack and make that worse. And then smokers are 12 to 13 times more likely to die from COPD than other non-smokers. So we as pharmacists can actually help people quit, and we can prescribe certain tobacco cessation products. So those products include things like patches, gums, lozenges, and they have nicotine in them to replace the nicotine that you would get from smoking so that you don't um, feel the need for a cigarette. You get the nicotine from something that's less harmful than smoke. So we as pharmacists provide the education on how to use those nicotine cessation products properly, because they're not exactly the same. Like the gum that we use, you can't chew it in the exact same way that you would normal gum. So we have to educate patients on how to use these products correctly.
So first, we're going to talk about nicotine gum, as shown on the picture on the right. This is a classic example of the packaging of the nicotine gum. So we also have some instructions here. So first, you would chew it slowly like you would with any other gum. And you would stop chewing when you notice kind of like peppery taste or like a tingle in your mouth. And you would park or at least put the gum between your cheeks and your gum inside your mouth, and then you would chew again when the taste or tingle fades away. The purpose of this is to make sure that not too much nicotine is going into your body at the same time. So you want to pace yourselves a little bit and make sure that you're putting the right amount of nicotine in your body and it's all spread out. And over time, the goal is to have patients be exposed to a less amount of nicotine as they go through this therapy, and hopefully, essentially, they just don't need any nicotine in their body, and they will not feel the withdrawal symptoms all at once. So next we have nicotine patches, similar to, I would say, probably like a Band-Aid, but like a bigger size Band-Aid. You would just put it typically right on your arm. And again, it has basically the same concept. Over time, you would want a lower dose of the nicotine patch, and essentially you would kind of not rely on the patch anymore, and hopefully that would give patients an opportunity to not feel the withdrawal symptoms. And I would say with these patches, you do want to switch areas just because some people do kind of get this swollen or redness from the patch. And in order to make it, or at least maintain its efficiency, switching it does help. And on the right, there's a little cartoon here that shows the possible side effects of these patches. So one that's diarrhea, headache, dizziness, vomiting, upset stomach, and of course, like I mentioned earlier, any redness or swelling at the site where you put the nicotine patch for up to 24 hours, or any itching, burning, or tingling feeling when it's applied. And if this is like a new product and you're developing a rash, we definitely do advise patients to reach out to a pharmacist or the physician, just because the patient may be allergic, and definitely going through different smoking cessation therapies is probably the better option than to do patches. And last, we're going to talk about lozenges. I would describe these kind of like a candy, except you don't chew them. You would have it dissolve slowly in your mouth, and like patches and the gum, the whole goal is to essentially decrease the amount of these lozenges that you need, and hopefully in the end, the patient would stop need stop needing the lozenges and not feel the withdrawal symptoms. And mainly for this therapy, the dose depends on when the patient takes their first smoke when they wake up. If they take their first smoke before 30 minutes of waking up, that's a different dose. And if they take their first smoke after 30 minutes they wake up, then they start at a different dose, and we kind of slowly decrease. And on the picture at the right, we see here that typical side effects of this product does include nausea, sore throat, hiccups, or any kind of heartburn. And of course, if any of these symptoms are really overbearing and the patient just cannot tolerate it, definitely reach out to a pharmacist or the physician to look at different other methods for smoking cessation. And lastly, here I have attached a Oregon tobacco quit line. So if you know anyone in your family or just anyone in general who is interested and is ready to quit smoking, definitely look at these resources. They can call the number, and it's available in English and Spanish, or go to the website to look at any resources, because they do help patients with who are ready to quit with resources. With a lot of resources, at least they would provide where to start. So that's a very good resources for people who are ready to quit, and they even have an option for youth vaping, and that's their website online.
So we've gone through asthma and we've gone through COPD, smoking, and then another lung condition is allergies. So allergies can be caused by many different things like gluten, eggs, fish, milk, but allergies also affect our lungs. So things like here in Oregon, we are the grass seed capital of the world. So I'm sure many of us suffer this time around in the year. I know it's starting. So I know I do. So that grass seed, it can get into our lungs, and our body thinks that it is a foreign particle and it doesn't like it. So our immune system jumps on it, and it can tighten your airways, cause a runny nose or itchy eyes. And that's just your body's natural immune response to get rid of something that it doesn't think should be there. So a foreign particle. So sometimes this can cause more severe reactions that can close off your airway completely, in which you don't get any oxygen, and that's really not a good thing. So people carry an EpiPen around with them, and what that does is you inject it into your thigh muscle, and it opens up your airways so that you can get oxygen to your brain so that you can breathe. So we have a video here to teach you guys how to use an EpiPen. It's really important to know how to use an EpiPen. I know even if you're not someone who carries an EpiPen or uses an EpiPen, it's really important to know how to use one in case of someone else having an anaphylactic reaction in which they can't breathe and are unable to administer it for themselves. So we're gonna go ahead and share this video. It's about 2 minutes long. So those of you on the recording can see this.
Practicing with the EpiPen training device can help ensure you, as well as your family and friends, know how to use the EpiPen autoinjector in the event of a severe allergic reaction. It's very important to only use your training device when practicing. Never use a real EpiPen to practice on yourself or others. The training device works the same as EpiPen, but without a needle or its medicine called epinephrine. The training device looks different from EpiPen. It's clearly labeled Trainer, and it's gray, while EpiPen is yellow and EpiPen Junior is green. To use, grasp your EpiPen autoinjector with the orange tip pointing downward, blue to the sky. Remove the blue safety cap by pulling straight up. Do not bend or twist it. Orange to the thigh. Place the orange tip against the middle of your outer thigh. Swing and push the orange tip firmly into your mid-outer thigh until you hear a click, and hold on your thigh for 3 seconds to simulate drug delivery. Count slowly. 1, 2, 3. Practice as often as you need. Reset the training device by replacing the blue safety cap, placing the orange tip on a hard surface, and squeezing the sides of the orange tip as you push down. The training device is now ready to use again. The training device can be used to teach family and friends how to use EpiPen at the first sign or symptom of an allergic reaction in case you aren't able to. To get a free EpiPen training device, or for more information about severe allergies and EpiPen, visit epipen.ca.
So that was our presentation today. So our goal today was just to give you some more information about different respiratory diseases like asthma, smoking, and any allergies. So hopefully you found this educational. And then I'll hand it off to Janie to say.
Yeah, so I hope you guys enjoyed our presentation. And of course, if you guys have any questions or comments about our presentation, feel free to reach out to us. I've also included Nick and Mackenzie's emails on there just in case if any one of you guys want to email them. And I hope you guys have a great rest of your day.
Thank you.